I'm here with Nurse Sharon, and welcome to our body contouring session here at 4:30 on our open house. So glad to have you. So when it comes to body contouring, there are now non-surgical options and surgical options. Of course, surgery is a bigger deal, a little more expensive, requires some downtime, and can accomplish a lot more. But non-surgical options are great nowadays, and you can see real differences. So Sharon and I today are going to talk a bit about surgical options. And in terms of body contouring, that usually involves somewhere on the trunk. So start at the breasts and work down, or start at the abdomen and work up. The classic, one of the things we get asked about most is liposuction, and we do quite a bit of that, don't we?
We do a lot of that. Liposuction gives you a great contour, even if you combine it with a tummy tuck. It's a great surgery if you're looking for the best contouring options.
So liposuction is basically designed to remove fat that's under the skin. There are some people that, based on their physical exam, we feel like, well, this skin might not shrink down very well, or we think it might shrink down fine. That depends on how it looks on physical exam, patient's age, and some other factors. For patients that need a little skin tightening, there are options for them as well. But generally, that's something that can be determined at the consult, where you'll meet Sharon and me and any of the doctors and their nurse. And basically a full kind of diagnosis where we figure out, okay, here's the issue and here's what you need.
We have a wide variety of ages that come to our office for consult for surgical body contouring. There are women that come in and want a mommy makeover. They've had their families, so they're interested in contouring breast and abdomen so they can get back to their selves before they had children. But we've even done tummy tucks on women that have been in their 60s, and they've had great outcomes and have been very happy.
Body contouring is something that really goes across the spectrum, all ages. It just depends on the contour needs. And then downtime is going to be related to how big the surgery is, right?
That's correct, yes.
So if it's just a liposuction, that might be a downtime of, half a week, maybe as little as that. And if it's a full tummy tuck, well, that might be a downtime of a week, 10 days, maybe a little bit more. And then certainly a few weeks staying out of the gym, keeping them off vigorous exercise, that kind of thing.
Absolutely. While you're recovering, you need to get your body to heal. And at a certain point, we do have you do some toning so that you can keep those abdominal muscles toned. But that's information that you get in your post-op period.
All right, and we'll talk a little bit specifically about tummy tuck. I mean, what it does, as we mentioned, is part of the mommy makeover, but it's not just for mommies, it's for anybody. We have younger people who just got some extra tissue down here they want to get rid of. Generally, we'll find with the surgery when we go in there that their muscles have loosened a little bit, and those can be tightened. There would be a scar from one hip to the other, but that generally covers pretty well with a bikini type garment, and really makes a very drastic improvement.
So you might have heard the term BBL, and you might wonder what that is, but that is a Brazilian butt lift, and that is a surgical contouring procedure that we do along with our tummy tucks and lipos and breast augmentation and breast lifts in our Quad A accredited outpatient surgery center here in the bottom level of our building in Winston-Salem. BBL is a procedure that involves doing liposuction of fat. You have to have enough fat to be able to harvest and transfer it into the butt for a butt enhancement or a butt augmentation.
So that's a surgery we do here, yes, in our fully accredited surgery center, and one thing we offer in terms of body contouring. There is an operation out there called buttock implants, which we don't do here because we think using your own tissue is a better option. So BBL is something we offer here at Forsyth Plastic Surgery. All right, some more surgery we offer in our accredited surgery center. If we move up a little bit, there's breast lifts, breast reduction, breast enhancement, breast augmentation, which is generally done with breast implants.
So breast lift, a breast reduction, breast augmentation applies to any age group, young adults to ladies in their 50s,
Yeah.
60s. We do them on all ages here in our surgery center.
Every now and then we'll find someone where we do a breast reduction later in life, and invariably they say, oh, I should have had this done years ago. I've had shoulder pain, I've had back pain, and issues like that. So it can be really helpful there. But then also, just, moms who develop some breast droop after the children, who really don't have a lot of volume. They just wanted it, put back where it was. And sometimes we can add volume with that, can't we?
Yep, you can add volume with an implant. It doesn't have to be a large implant, but just to get some upper fullness that you had when you were younger. A smaller implant could go in there as well and give you a nice breast and contour there that you've probably been wanting for a while.
That's right. And so really that determination would be made at the consult, where you're seen by the doctor and the nurse, and once again we make the diagnosis to say, okay, well, here's your issue and here's the best way to fix that. In terms of recovery, generally breast surgery, most of our breast surgeries, a week or so, 5 days, 10 days, depending upon your pain tolerance. But most people are back to work pretty soon, and they see the result right away.
Right. Instant gratification.
That's right. A little swelling early on, but hopefully we'll get you in our book that shows befores and afters.